Do you know what a pulmonary embolism is? Let's go. Now, this is going to be a clot that eventually is going to go through the heart and possibly into the lungs, which causes a severe emergency. This most commonly occurs in the popliteal vein, typically after surgery. And what's happening here is a group of cells, specifically your red blood cells, and your platelet cells, will begin to group together and form a physical clot as if they're glued by super glue. And it'll travel through the veins all the way up to the heart, into the lungs, and it can lodge itself in one entire lobe of the lung or half the lung, causing a severe emergency. Now, because that blood clot behind the knee is such a huge issue that could cause permanent damage system-wide, what they'll do clinically is they'll use what's called the Wells Prediction Criteria rule. And when they do that, they're looking at a score that's assessed on you to determine whether you're at a high risk or a low risk of having that blood clot. And then after that, they'll, depending on the result, refer you to another provider who can do an ultrasound image to try to find that precise blood clot. Finally, they will also do a blood test on you called a D-dimer that can assess and determine whether there's a blood clot somewhere in your body.